Welcome to this channel, your go-to resource for educational content on medicine, pharmacy, and health, designed to empower your learning and practice. In today's quiz, we are looking at parasympathomimetics. Don't forget to check out the companion video on this channel, which provides an overview of the main concepts for this topic. You'll find the link in the description below. Quiz instructions. This video will feature 10 multiple-choice questions focused on parasympathomimetics. Each question has 5 options, and only one will be correct. For every question, we'll provide a detailed explanation of the correct answer and clarify why the other options are incorrect. This ensures you not only know the right answer but also understand the underlying concepts thoroughly. Question 1. Which of the following is the primary mechanism of action of direct-acting parasympathomimetics? Option A, inhibition of acetylcholinesterase. Option B, stimulation of muscarinic receptors. Option C, stimulation of nicotinic receptors only. Option D, blocking adrenergic receptors. Option E, preventing acetylcholine release from nerve terminals. The correct answer is option B, stimulation of muscarinic receptors. The explanation is as follows: direct-acting parasympathomimetics work by directly binding to and stimulating muscarinic receptors, mimicking the action of acetylcholine at these sites. This action enhances parasympathetic responses, such as increased glandular secretions, smooth muscle contractions, and slowed heart rate. Here is the explanation for incorrect options. Option A is incorrect because inhibiting acetylcholinesterase is the mechanism of indirect-acting parasympathomimetics, not direct-acting ones. Option C is incorrect because direct-acting parasympathomimetics target muscarinic, not just nicotinic receptors. Option D is incorrect because blocking adrenergic receptors relates to sympatholytic, not parasympathomimetic activity. Option E is incorrect because preventing acetylcholine release would inhibit, not mimic, parasympathetic activity. Question 2. Pilocarpine, a parasympathomimetic agent, is most commonly used in the treatment of which condition? Option A, myasthenia gravis. Option B, bradycardia. Option C, glaucoma. Option D, asthma. Option E, urinary retention. The correct answer is option C, glaucoma. The explanation is as follows: pilocarpine is commonly used to treat glaucoma by stimulating muscarinic receptors, leading to increased aqueous humor outflow. This reduces intraocular pressure, a key therapeutic goal in glaucoma management. Here is the explanation for incorrect options. Option A is incorrect because myasthenia gravis is treated with acetylcholinesterase inhibitors, not muscarinic agonists like pilocarpine. Option B is incorrect because pilocarpine does not have a role in treating bradycardia and may worsen it by increasing vagal tone. Option D is incorrect because pilocarpine can exacerbate bronchoconstriction and is contraindicated in asthma. Option E is incorrect because pilocarpine is not a first-line treatment for urinary retention. Question 3. What is the primary adverse effect associated with the use of indirect-acting parasympathomimetics? Option A, hypertension. Option B, xerostomia. Option C, excessive salivation and diarrhea. Option D, bradycardia. Option E, blurred vision. The correct answer is option C, excessive salivation and diarrhea. The explanation is as follows: indirect-acting parasympathomimetics enhance acetylcholine activity, leading to overstimulation of muscarinic receptors. This commonly manifests as excessive glandular secretions, such as salivation, and hyperactivity of the gastrointestinal system, causing diarrhea. Here is the explanation for incorrect options. Option A is incorrect because indirect-acting parasympathomimetics lower blood pressure through parasympathetic activation. Option B is incorrect because xerostomia refers to dry mouth, which is the opposite of increased salivation. Option D is incorrect because bradycardia is possible but not the primary adverse effect. Option E is incorrect because blurred vision is a secondary effect and less common compared to gastrointestinal and salivary symptoms. Question 4. Which of the following is contraindicated in a patient using direct-acting parasympathomimetics? Option A, hypertension. Option B, peptic ulcer disease. Option C, diabetes mellitus. Option D, hyperthyroidism. Option E, Parkinson's disease. The correct answer is option B, peptic ulcer disease. The explanation is as follows: direct-acting parasympathomimetics stimulate muscarinic receptors, increasing gastric acid secretion and worsening peptic ulcers. This makes their use contraindicated in patients with active or recurrent peptic ulcer disease. Here is the explanation for incorrect options. Option A is incorrect because direct-acting parasympathomimetics typically lower blood pressure. Option C is incorrect because diabetes mellitus is not directly impacted by these drugs. Option D is incorrect because hyperthyroidism is not exacerbated by parasympathomimetics. Option E is incorrect because Parkinson's disease does not contraindicate their use. Question 5. Which of the following is the correct role of acetylcholinesterase inhibitors in the treatment of Alzheimer's disease? Option A, stimulates beta-adrenergic receptors to enhance cognition. Option B, increases synaptic acetylcholine to improve memory and cognition. Option C, reduces neuronal damage by blocking glutamate receptors. Option D, inhibits GABAergic activity to promote alertness. Option E, prevents dopamine breakdown to increase neuronal activity. The correct answer is option B, increases synaptic acetylcholine to improve memory and cognition. The explanation is as follows: acetylcholinesterase inhibitors prevent the breakdown of acetylcholine, increasing its availability in the synapse. This compensates for cholinergic deficits in Alzheimer's disease, improving memory and cognitive function. Here is the explanation for incorrect options. Option A is incorrect because beta-adrenergic stimulation is unrelated to Alzheimer's therapy. Option C is incorrect because reducing neuronal damage via glutamate receptor blockade relates to NMDA antagonists like memantine, not acetylcholinesterase inhibitors. Option D is incorrect because GABAergic inhibition is not a therapeutic target in Alzheimer's disease. Option E is incorrect because acetylcholinesterase inhibitors do not affect dopamine metabolism. Question 6. What is the most likely result of excessive stimulation of muscarinic receptors by parasympathomimetic drugs? Option A, mydriasis and tachycardia. Option B, increased sweating and salivation. Option C, skeletal muscle paralysis. Option D, bronchodilation and increased heart rate. Option E, vasoconstriction and increased blood pressure. The correct answer is option B, increased sweating and salivation. The explanation is as follows: excessive stimulation of muscarinic receptors leads to parasympathetic effects, including increased activity of exocrine glands such as sweat and salivary glands. This is a hallmark response to cholinergic activation by parasympathomimetics. Here is the explanation for incorrect options. Option A is incorrect because mydriasis and tachycardia are sympathetic effects, not parasympathetic. Option C is incorrect because skeletal muscle paralysis is mediated by nicotinic, not muscarinic, receptors. Option D is incorrect because bronchodilation and increased heart rate are sympathetic effects. Option E is incorrect because vasoconstriction and increased blood pressure are also associated with sympathetic stimulation, not muscarinic receptor activation. Question 7. Which of the following parasympathomimetic drugs can cross the blood-brain barrier and is used for central nervous system effects? Option A, neostigmine. Option B, bethanechol. Option C, physostigmine. Option D, atropine. Option E, ipratropium. The correct answer is option C, physostigmine. The explanation is as follows. Physostigmine is a tertiary amine that can cross the blood-brain barrier, making it effective for treating central nervous system conditions, such as atropine overdose. This ability sets it apart from other parasympathomimetics like neostigmine. Here is the explanation for incorrect options. Option A is incorrect because neostigmine is a quaternary amine and cannot cross the blood-brain barrier. Option B is incorrect because bethadicol acts peripherally and does not affect the CNS. Option D is incorrect because atropine is a muscarinic antagonist, not a parasympathomimetic. Option E is incorrect because ipratropium, like atropine, is a muscarinic antagonist used for respiratory conditions. Question 8. What is the primary adverse effect associated with the use of muscarinic agonists? Option A, hypertension. Option B, tachycardia. Option C, excessive salivation and sweating. Option D, hyperglycemia. Option E, constipation. The correct answer is option C, excessive salivation and sweating. The explanation is as follows. Muscarinic agonists activate parasympathetic pathways, which can lead to overstimulation of exocrine glands, causing significant salivation and sweating. These effects are commonly reported with muscarinic agonists. Here is the explanation for incorrect options. Option A is incorrect because muscarinic agonists tend to lower blood pressure due to vasodilation. Option B is incorrect because muscarinic stimulation slows the heart rate rather than causing tachycardia. Option D is incorrect because muscarinic agonists do not influence blood glucose levels. Option E is incorrect because muscarinic activity enhances gastrointestinal motility, reducing constipation. Question 9. A patient presents with symptoms of organophosphate poisoning. Which of the following is the most appropriate treatment to reverse cholinergic toxicity? Option A, atropine and pralidoxime. Option B, pilocarpine and neostigmine. Option C, scopolamine and atropine. Option D, physostigmine and epinephrine. Option E, phenylephrine and pralidoxime. The correct answer is option A, atropine and pralidoxime. The explanation is as follows. Atropine is a muscarinic antagonist that blocks excessive acetylcholine activity at muscarinic receptors, while pralidoxime reactivates acetylcholinesterase inhibited by organophosphates. This combination is the standard treatment for organophosphate poisoning. Here is the explanation for incorrect options. Option B is incorrect because pilocarpine and neostigmine further increase cholinergic activity, worsening symptoms. Option C is incorrect because scopolamine does not reverse the enzyme inhibition caused by organophosphates. Option D is incorrect because physostigmine exacerbates cholinergic symptoms, and epinephrine is not directly relevant. Option E is incorrect because phenylephrine has no role in treating cholinergic toxicity. Question 10. A 45-year-old patient is diagnosed with myasthenia gravis. Which parasympathomimetic drug would most likely be prescribed to improve their symptoms? Option A, edrophonium. Option B, pyridostigmine. Option C, atropine. Option D, pilocarpine. Option E, scopolamine. The correct answer is option B, pyridostigmine. The explanation is as follows. Pyridostigmine is a long-acting acetylcholinesterase inhibitor that increases acetylcholine levels at the neuromuscular junction, improving muscle strength in patients with myasthenia gravis. Its duration of action makes it suitable for long-term management. Here is the explanation for incorrect options. Option A is incorrect because edrophonium is short-acting and used primarily for diagnosis, not long-term treatment. Option C is incorrect because atropine is a muscarinic antagonist and does not address the underlying cause of myasthenia gravis. Option D is incorrect because pilocarpine is used for glaucoma and xerostomia, not myasthenia gravis. Option E is incorrect because scopolamine is used for motion sickness, not neuromuscular disorders. Further tips for revision. As a form of recap, take note of the following 4 tips to help you tackle similar questions effectively. The first tip is that words like except or not often indicate a tricky phrasing. Read the question carefully to avoid mistakes. The second tip is that understanding the mechanisms of action helps eliminate incorrect options quickly. The third tip is that knowing drug-specific uses, such as pilocarpine for glaucoma, is critical for answering application-based questions. The fourth tip is that adverse effects often differentiate between drugs within the same class, so focus on learning these distinctions. That wraps up our revision on parasympathomimetics. I hope you found this quiz insightful and engaging. For further reading, consider Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF, as excellent resources. If you enjoyed this video, leave your questions or comments below. Don't forget to subscribe for more content, and follow us on Instagram, Facebook, and Spotify for more engagement and resources. Thank you for watching, and see you in the next video.